American Heart Association and the American Stroke Association are issuing stroke guidelines for women for the very first time. The groups emphasize that women share many of the same stroke risk factors as men do, but hormones, birth control, pregnancy, and childbirth also play a role. The guidelines also say diabetes, migraines, depression, and stress seem to be stronger in women.
Women tend to have more something called endothelial dysfunction, which means the lining of the small vessels can be very reactive, and those can react to emotional stress.
Doctors say regular checkups, a low-sodium diet, and exercise go a long way in keeping women healthy. Well, millions of people suffer from sleep problems. We know the factors such as weight and caffeine can cause some of those problems.
Yeah, but what about the structure of your face? Mary Nichols with more in tonight's Check Your Health report.
There's recent evidence that large percent of the population is not even getting 6 hours of sleep.
Millions of Americans suffer from sleep problems, such as insomnia or sleep apnea. Ideally, you should be getting at least 7 hours of sleep at night. And when you don't, it can affect more than just your mood.
And this causes big problems. It causes health problems, it causes accidents, and it causes people just not to function properly.
Dr. Howard Leaman specializes in sleep medicine at Intermountain Sleep Disorder Center at LDS Hospital. He says there are many factors that can cause disruption in your sleep, such as your weight. But he also says the structure of your face could be a factor.
People with long, thin heads, very narrow maxillary bones, and regressive chins, and long, skinny noses, and they don't breathe so well either.
For example, if you have a long, skinny nose, you may have trouble breathing while you're trying to sleep.
The narrow bone here, narrow maxillary bone, limits the inflow of air, which causes resistance, which causes awakenings, which sets up a cycle of awakenings.
Treatment for sleep problems can vary depending on the person. In most cases, doctors will have you use a CPAP machine. That machine helps keep the airway open while you're sleeping. If you're having trouble sleeping, the best advice is to see your doctor. Mary Nichols for Check Your Health.
Some other things that may affect your sleep: your laptop, the dessert you may have after dinner before you go to bed, and your pets. We'll be talking about sleep problems during our Ask the Expert Infothon next Tuesday. That'll be right here at KUTV on 2 News.